It has been 2 weeks since our last press conference, and since then the situation has stabilized, with cases remaining at more than 3,000 cases a day. However, the week-on-week ratio of infection has come down to below 1 over the last few days, and it was 0.81 as of 7th of November. The number of cases in hospitals and the proportion of cases with severe illness have also remained stable. Minister Ong Ye Kung and DMS will provide more details later. I would like to take this opportunity to thank Singaporeans for their support and for working together to slow down the transmission. With the situation stabilizing, we are now in a better position to ease some of our safe management measures without overwhelming our healthcare system. We will take a careful, step-by-step approach, and we will continue to monitor the situation and adjust as we go along. First, on dining in. From 10th of November, we will allow up to 5 fully vaccinated persons from the same household to dine in together at F&B establishments. This excludes hawker centres and coffee shops, and the NEA will work with them to put in place measures to allow them to do so. Second, we will explore further easing in settings that allows only vaccinated persons with additional requirements of pre-activity testing. For a start, we will begin with pilots in sports settings. We will also extend this pilot to selected mass sporting events as well as MICE events. Minister Wong will elaborate further. And third, Ministry of Education will also gradually resume more school activities, including in-person classes, group work, and co-curricular activities. These are very important for the education for our children. MOE will provide a separate update later. We will also refine some of our SMMs for businesses. I would like to take this opportunity to also thank our businesses for doing your best in implementing and adhering to the current SMMs. We will adjust some of these safe management measures to better facilitate your operations. For example, we will increase the zone sizes for various events categories, such as cinemas, live performances, as well as MICE events. We will also allow recorded music to be played at the F&B outlets. As we gradually reopen, it is inevitable that the number of COVID-19 cases may rise, as seen in our past experience. We will need to continue to protect those who are unvaccinated, as they are at higher risk of severe outcomes. Therefore, vaccine-differentiated safety measures will continue to be a key pillar of our reopening strategy. We will explore the expansion of VDS to more settings, and we will announce further details in the coming weeks. While we have extended a concession to those who are medically ineligible for vaccination so that they will be able to access these premises or participate in activities where VDS are imposed, please do try your best to minimize unnecessary exposure. This is to protect you and to reduce your risk of infection. As the global situation evolves, we continue to review and adjust our border measures and update the country and region classifications. Travelers from the Category 2 and Category 3 countries and regions can now choose to undertake either a PCR or professionally administered ART pre-departure tests. In addition, we will extend vaccinated travel lanes scheme to include Finland and Sweden. I want to thank everyone for your support and cooperation during the stabilization phase. We are now in a better position to make some adjustments to our SMMs and continue our journey towards living with COVID-19. However, I would also like to encourage everyone to remain vigilant, continue to exercise social responsibility, and make testing a way of life. This will help us to keep the growth ratio in the weekly infections low and protect our healthcare system and our healthcare workers. Let us all continue to do our part so that we can resume more economic and social activities progressively. I'm confident that if we all work together, we will be able to become a COVID-19 resilient nation. Thank you. I'll now ask Minister Ong Ye Kung to give a quick update.
Thank you. Let me revisit the analogy I used at the last press conference, which is that COVID-19 is like riding a bike down slope. You do nothing, it goes faster and faster until you lose control and it crashes. And that is why we apply brakes so that the bike goes down at a controlled speed and we can arrive safely at our destination. And there are 3 brakes, which is safe management measures, vaccination and boosters, and then border restrictions. How fast is our bike going down the slope now? With everything that we are doing, we have VTLs, we have border openings, selected ones, wide coverage of vaccination, active boostering, safe management measures such as masks and group of 2. The bike is actually slowing down. And hence we see the week-on-week infection ratios going down, going below 1. Our estimation of reproduction rate of the virus is now probably about 0.9. Situation is in our ICU ward is not getting worse, it's stable, improving slightly, but only slightly. And we are watching all these numbers and their trajectory very closely. Many MOH experts or healthcare experts that you have read in the papers, and they have all expressed that while the situation has improved, by no means have we reached an equilibrium with the virus, or are we in a steady state situation yet. There is no doubt, if tomorrow we remove all the safe management measures, infections, ICU numbers, and deaths will spike up rapidly. But the current situation, with all the measures currently in place, give us some scope to relax the measures that we spoke about at the last press conference. And so on that break of safe management measures, there can be some relaxation measures, as mentioned by Min Gan, and Minister Lawrence Wong will elaborate on it. As for the break on border control, the general situation has not changed, which is that the pandemic situation has stabilized in many countries, and in fact, many of them, their infection rates are lower than Singapore, which make this break still not so relevant in today's circumstances. There has, however, been a new development since our last press conference, and I want to just speak on it a little bit, which is a new wave of infections in Europe as they approach winter. The WHO has warned that Europe is once again at the epicenter of the pandemic. The new wave in Europe is due to insufficient vaccination take-up. According to WHO, 3/4 of new cases in Europe were aged over 65 years, and most were unvaccinated. So we see in European countries with lower vaccination rate, such as Germany, France, Switzerland, they are seeing more people getting hospitalized as compared to those countries like Denmark, Italy, and Spain with higher vaccination rates and fewer people getting hospitalized. And that is why COVID-19 pandemic continued to be described as a pandemic for the unvaccinated. So overall, despite the rising cases in Europe, infection rates are not out of control in Europe. To illustrate, Singapore's infection rate, based on the past 7 days average, is about 46 per 100,000 population. Denmark and Germany, despite rising cases, are at 28. Spain is below 5. Sweden is 8. France is 10. Switzerland 24. Netherlands 51. UK 55. So all comparable within a certain range. MOH will continue to monitor closely the situation in Europe and elsewhere in the world too. What is noteworthy is our own region, Southeast Asia. The pandemic situation is fast stabilizing. We will therefore be adjusting the risk classification for several ASEAN countries, including upgrading Cambodia, Indonesia, Malaysia, and Vietnam from Category 3 to 2, and then Laos, Myanmar, the Philippines, and Thailand from Category 4 to 3. And this gives us scope to start opening up our borders with regional countries as well. The next set of breaks are vaccination and boosters. Including those who have received their first doses, we have covered 95% of our eligible population. And this has been a tremendous feat. So when we report every night in our press release that 85% of our total population has completed their full primary series regimen of vaccines, the remaining unvaccinated individuals comprise mainly two groups. First are the eligible groups who remain unvaccinated. Second, children below 12 who are not yet eligible. For the first group, we are particularly concerned about unvaccinated seniors above the age of 60, as they are very likely to fall seriously ill if infected with COVID-19. But with the hard work of all our vaccination teams, we have reduced this group significantly. The size of this group was 175,000 in early August. Today is below 64,000. If not of this reduction, our hospitals and ICUs today would have been already overwhelmed. So I want to once again thank all our partners who made this possible, and especially those who volunteered their time. We have mobile vaccination teams and home vaccination teams. They were especially critical in bringing vaccinations closer to the seniors. Since July 2021, the mobile vaccination team has reached 70,000 persons, including 27,000 seniors. And now, given that Sinovac vaccine is part of the national vaccination program, from the 8th of November, which is tomorrow, from today, our mobile vaccination teams will also administer the Sinovac vaccine. Since 30th October, we started using the Sinovac vaccine at the Raffles City Vaccination Center and a few approved clinics, and allowed walk-ins for seniors if they are aged above 60. And since then, more than 2,900 individuals have come forward to receive their first dose of the Sinovac vaccine, and amongst these 2,900, 500 are seniors. So it's not huge numbers, but 3 doses of the Sinovac vaccine can provide good protection against COVID-19 related severe illnesses and deaths, and it will further reduce the number of vulnerable unvaccinated seniors. Next, our booster program is also progressing well. As of 4th November, amongst those who have been invited to receive their boosters, 85% of those aged 60 years and above have received their booster dose or booked an appointment. 52% of those aged 50 to 59 and 67% of those aged 30 to 49 have done so. Before the end of the year, we should have 50% of our population taken their boosters. We can already see the difference boosters are making to both case numbers and severity of illnesses. In the coming weeks, it will make a huge difference in terms of living with COVID. From one end of the age spectrum, let us now move to the other end, which is our children. The incidence of COVID-19 infection in children has been increasing with the local surge in cases. While children have a lower risk of severe disease, with a large number of cases, a small number can still develop life-threatening disease and severe later complications such as the MIS-C or multi-system inflammatory syndrome in children. And so far, we have 4 such cases out of 8,000 children COVID-19 infections, translate into 0.05%. Vaccination will reduce this risk. Dr. Janil Putticherry and DMS Kenneth Mark will speak more about this later, but I want to say something about vaccination of children. MOH has been in talks with Pfizer to prepare for the vaccination of children aged 5 to 11 years. We have said and reported that the whole process will likely take us to early next year before vaccination can start. The major development over the past week had been the authorization by the US Food and Drug Administration, FDA, for the emergency use of Pfizer-BioNTech COVID-19 vaccine for children aged 5 to 11 years. Twitter is now full of pictures of children in the US receiving their COVID-19 vaccines. I was told Sesame Street made a video of one of their Muppets, Rosita, taking her vaccination as well. So they are promoting this in the US. The decision was made in the US after a clinical trial conducted by Pfizer for children in this age group. Each of them, as recommended by the drug manufacturer, received 1/3 of the full adult dosage. So children will still receive 2 doses, separated. Each dose is 1/3 that of the adult dosage. And that was done during the clinical trial in the US. And the study in the US concluded that vaccination for this group is safe and effective based on this reduced dosage of the adult formulation of the vaccine. Our expert committee on COVID-19 vaccination, the EC19V, has studied the data and agreed with the conclusions of the US review. They assess that in Singapore, it is overall beneficial for children to receive the vaccines, especially in the current setting of community transmission. The expert committee will soon, we expect maybe second half of this month, to make a recommendation on the use of the Pfizer-BioNTech Comirnaty vaccine for children aged 5 to 11 years in Singapore. At the same time, MOH is embarking on a study involving a few hundred children in this age group who will receive the recommended smaller dosage of adult formulation. This is partly to see the results for ourselves in the local context, but more importantly, to work out a smooth vaccination process for the children and their parents before we scale up. Hence, we are pushing ahead with vaccination for children aged 5 to 11 years as soon as we can. And once the EC19V has finalized their recommendation and given the go-ahead. And this is so that parents have the added assurance and peace of mind that their children can become protected. And once vaccinations cover children aged 5 to 11 years, we would have left only a small proportion of our population not covered by vaccines, and mainly 2 groups. For the very young, aged 0 to 4, we will have to continue to monitor the development of vaccines suitable for them. And fortunately, by and large, the virus tends to affect this group less adversely. As for children who do not want to take, as for individuals who do not want to take any of the vaccines, we will need to have safe management measures which differentiate between the vaccinated and unvaccinated. This is in order to protect the unvaccinated and also to preserve our healthcare capacity. One example are the restrictions on the unvaccinated to participate in higher risk activities and settings, such as dining in restaurants, hawker centers, and coffee shops. For hawker centers and coffee shops, we now rely on a light touch approach of checking to see if they are vaccinated. But it is a high-risk setting, and we will need to move towards a system of more thorough checks at the entrances to ensure that vaccination differentiation is well implemented. As I have mentioned in a recent parliamentary reply, MOH will also have to impose hospital charges for COVID-19 patients who are eligible but choose not to be vaccinated, and this will start on 8th December 2021. Our hospitals really much prefer not to have to bill these patients at all. But we have to send this important signal to urge everyone to get vaccinated if you are eligible. Billing will still be based on our current subsidy framework, subject to Medisave use and Medishield life claims. So it will still be highly supported and highly subsidized. Finally, let me just say a few words on healthcare capacity, specifically on the home recovery program. And my colleagues will elaborate further on ICU and condition of patients. For HRP, operations have been stable and quite smooth. Response time have improved greatly. Currently, over 90% of COVID-19 patients receive their follow-up call from MOH within 24 hours to onboard them. However, there's still the last 10% who are not onboarded on time. The key is for the individuals to fill up the form.sg quickly and properly once you receive the SMS notifying that you have a positive PCR results. Fill up the form.sg quickly, and that will immediately trigger and automatically trigger the response from the HRP operations team and resolve most of the delays and most of the problems. As for those who require telemedicine consultations, the average waiting time has been brought down to around 2 hours now. I want to specifically address the concerns of one group, which is our seniors, who prefer to recover at home because loved ones are around and they are familiar with the surroundings. I want to assure our seniors that although our healthcare protocol says that by default, we convey COVID-19 patients above 80 years old to hospitals, this is a guideline, a default guideline. Where such patients prefer to be cared for at home, we want to support you to do so, including through the home-based care programs of many of our hospitals. But if we do so, we must also be prepared for the possibility that some patients who are at the end of their lives and who requested to be cared for at home, they may pass away at home. And should this happen, we will also make the subsequent process smoother. There was a recent case reported in the media on a senior who tested positive using ART and then subsequently passed away at home. And the family had difficulty having the body conveyed out of the residence. I read a follow-up letter from the Association of Funeral Directors, which said that the current MOH rules do not allow them to handle COVID-positive cases in residential premises. So we will take the feedback and revisit the regulations. If they are unclear, we will improve them. We will also work closely with NEA and some of the funeral directors to ensure that whatever revised regulations we have allow them to safely handle COVID-positive cases who pass away at home. We are seeing more and more seniors with advanced medical conditions want to undergo palliative care and spend their last precious moments at home in the presence of loved ones. And we respect these decisions. We think it reflects a positive shift in societal attitude, and MOH will support this shift. Let me now hand the floor over to SMS Janil Puthucheary.
Good evening, everybody, and thank you for joining us today. I would just say a little bit about the hospital situation and the ICU situation as well. The overall numbers have remained stable, but the total number of patients that our colleagues in the hospitals and the ICU manage remain high, well past the baseline pre-COVID. So we are pressing ahead with the expansion of our overall hospital capacity in order to provide care for hospitalized COVID-19 patients. So we continue to collaborate with the private sector as well as other healthcare providers to take in COVID-19 patients, increasing the capacity in our private sector and COVID-19 treatment facilities. Currently, there are around 2,500 beds, and less than half are occupied. Nevertheless, we continue to ramp up, and we expect to have a capacity of up to 4,000 beds by the end of November. The ICU occupancy has improved slightly from last week as more ICU beds are added for COVID-19 patients. We now have about 280 ICU beds for COVID-19 patients, and about 134 patients occupy those beds, about 50%, down from about 60% last week. But that improvement in the percentage is primarily because of the increase in the denominator. We've increased the capacity. We also continue to have about 140 to 150 non-COVID-19 ICU patients in our system at the same time. Among the COVID-19 ICU cases, the majority are seniors above 60 years old and above, and most are also not fully vaccinated. Our unvaccinated elderly remain at highest risk of requiring intensive care once infected with COVID-19, and we have to continue to try to keep this number as small as possible. On Saturday, the Ministry of Health updated that there are 4 rare cases of multi-system inflammatory syndrome in children, 2 of whom have recovered and have been discharged. I've just heard that there's a 5th case admitted. It won't be counted in today's statistics. It'll count in tomorrow's statistics, but this will become our 5th case of MIS-C. The ones that are still in hospital are being stabilized by the team and are recovering. And Director of Medical Services will touch a little bit more about these cases later on. But let me share a little bit of information. This condition, it affects different body organs, including the heart, the lungs, the kidneys, the brain, the eyes. It can be inflamed. And it's a rare condition, and it's noted to occur following the infection of a child with COVID-19. However, the manifestation of this disease is very similar to Kawasaki disease, which is a condition that our doctors here in Singapore are very, very familiar with. And so MIS-C, as far as we can tell, although it's serious, it has risks, and it does potentially require intensive care treatment, with timely access to the right care, it's eminently treatable, and we will need to do our best for all of these children, and with the full expectation that they will respond to the treatment that we provide. The 4 cases, now 5, identified with MIS-C are among the over 8,000 pediatric COVID-19 cases in Singapore since the start of the pandemic. Remember that most children with COVID-19 infection will be entirely asymptomatic or stable, not requiring intensive care, not requiring oxygen. And the best measure to protect all our children from both MIS-C as well as COVID-19 infection is to avoid them getting COVID-19 in the first place. So good personal hygiene, safe management measures, and then when vaccination becomes available for children, if we can all adopt that, that will help to protect them as far as possible. For our healthcare workers, they continue to be stretched. They are trying their best to provide the best possible care for COVID-19 patients. And MOH is also supporting them by augmenting the hospital manpower. One way we're doing this is by redeploying now about 300 staff from swab operations to our CTF, and also to then tap on private healthcare capacity and getting admin staff to go and help some of the administrative roles that our healthcare workers are having to provide as well. We're also working with the Ministry of Manpower to ease the process of work pass renewals for foreign doctors and nurses who have been working alongside us in this COVID-19 fight. And they're a valued part of our healthcare workforce. This will also support our efforts to step up recruitment of doctors and nurses from overseas. We're also trying to find other ways to lighten the load and reduce staff burnout, training more staff, training more volunteers, taking over basic patient care tasks so that our healthcare workers can concentrate on what are the most pressing needs at this point. Nevertheless, making sure that staff morale is supported continues to be a challenge, especially in this trying period. Our staff in the healthcare system have been under immense pressure, and they've managed a high workload for the past 2 years, caring for both COVID and non-COVID patients. And our public healthcare sector sees the majority of the elderly patients with comorbidities. It's resource intensive, it's taken a toll on them. The last week has given them a little bit of a breather as the cases have stabilized and we've expanded our capacity. But they're worried and prepared for an increase in cases should it come. The staff morale has also been affected in the past by some of the incidents where they themselves have seen their colleagues affected by this. And thankfully, with now a very high vaccination rate, they are mostly young, and so they are mostly healthy and protected. But the fatigue carries on. The award that Minister announced a few days ago for our healthcare workers to show our recognition and support, I know has been well received by all the staff. And they appreciate this effort. They appreciate the recognition. They know that this is part of the token of recognition, that it's a token of our support and admiration and recognition for healthcare workers. I know they will also warmly receive the announcements today of some of the differentiation as well as the opening up. They too have families that they would like to go out and have food with and eat with when they have a rest break. But they are concerned about the vulnerable in our population, and the vaccine differentiated strategies that have just been announced will help to reduce the risk for the most vulnerable. And our healthcare workers will very much appreciate that effort to try to protect the most vulnerable in our population. Our healthcare workers are our last line of defense. We need to look after them so that they can look after us. And for all of this, we talk about the work that MOH can do to support them, the award that we can provide them with, the way we can protect the entire population. I would urge and ask that one other way that we can support them is to provide them the respect, the courtesy, and the consideration that they so rightly deserve. They are highly trained professionals discharging their duty, doing what's needed in order to look after all of us. And I would ask that when we come into contact with them, we treat them with that respect, that courtesy, and that consideration that their role, their task, and their duties, I think, justify. We will look after them so that they can look after us. Thank you very much.
Both Minister Ong and SMS Janil have spoken about our children and the risk that they may have getting COVID-19 infection. We've been focusing particularly on those aged less than 12 years. SMS Janil had shared that there have been 8,000 pediatric COVID-19 cases in Singapore in that age group. We've looked at the incidence of COVID-19 infection for children less than 12 years of age since the 1st of January this year. We started the year with 37 children diagnosed to have COVID-19 in January. And this translates to an incidence of about 7 cases per 100,000 children. The incidence has varied over the first 6 months, ranging from 2 per 100,000 children in March to 13 per 100,000 in May. Since August, we have started to see a significant rise in the number of cases of COVID-19 infection in children. And this is in keeping with the overall risk in the community situation, because there has been a rise in community numbers of COVID-19 infections. The incidence of COVID-19 was 38 per 100,000 in August, and has continued to climb to about 313 per 100,000 in September, and about 1,220 per 100,000 children in October. In absolute numbers, we saw just about 6,000 children less than 12 years infected with COVID-19 infection last month. And this is in keeping with the higher community numbers that we have seen overall. SMS Janil has shared that the majority of children with COVID-19 infection remain stable and have mild infections. This is indeed the case in Singapore. Overall, out of the 8,000 over cases that we've seen, we have had 2 children admitted to the ICU for care, and another 2 children who have required oxygen supplementation. And this translates to 0.4 per 100,000 children with severe infections requiring ICU care, and another 0.4 per 100,000 children needing oxygen support. The measures that have been put in our schools and preschools, which include mask wearing, hand hygiene, safe distancing measures, have all been effective in reducing the risk of infection spreading in these settings. Many of our infections in children continue to take place in community settings, where children may get infected within their households and where mask-off interactions take place. And therefore, it remains important for these measures to continue as long as is possible to protect our children from COVID-19 infection. Ministers shared that our expert committee on COVID-19 vaccines, or EC19V for short, is studying recommendations to introduce COVID-19 vaccinations for children between the age of 5 and 11 years. We will not be the first country to consider doing so. The US FDA has already approved the Pfizer-BioNTech vaccine for children in this age group, and other countries are following suit, as they too have seen high numbers of children being infected. The dose recommended for children is only 1/3 of the full adult dose, but this dose has, in the clinical studies, been shown to be as effective as the full dose administered in adults. The reduced pediatric dose has also been associated with a low risk of side effects, which attests to the safety of the revised vaccination regime for children. The side effects were similar to that seen in our vaccination of adults and mainly comprise local reactions like pain, swelling, redness, or more systemic effects like fever, headaches, muscle and joint aches, or diarrhea. A small proportion of children experience allergic reactions which resolved with treatment, and the rate was not higher than that seen in the adult population. In particular, there were no cases of myocarditis reported with the revised pediatric regime in the study. And the data suggests that the pediatric regime is safe, which is why both the US CDC and FDA have approved extending COVID-19 vaccines using the Pfizer-BioNTech vaccine to children between 5 and 11 years. The study in the US involved a reduced dose regime using the adult formulation. Pfizer is producing a purpose-designed pediatric formulation with the same essential mRNA vaccine ingredient, and the revised formulation uses a different buffer solution which will allow it to be stored under more conventional cold chain requirements without the need for an ultra cold chain supply chain, and makes it easier to draw the required amount of vaccine out of the vial. However, as the pediatric vials are as yet not commercially available, and we anticipate considerable global demand for what is already proven to be an effective mRNA vaccine against COVID-19, we are studying whether we can provide vaccinations for children between 5 and 11 years using the existing Pfizer-BioNTech vaccine vials that we have supplied to us. And we are confident that vaccination using these vials will be effective and safe. The study we are embarking on, which Minister has shared, involving several hundred children, is mainly to see how we can best operationalize our processes and efficiently extract the desired reduced doses for children once EC19V confirms its recommendations for vaccinating the larger proportion of children between these age groups. Once we are able to do so consistently, we will then be able to provide an extended national vaccination program that gives parents the added assurance that their children can be further protected against getting a severe COVID-19 infection. At this time, the Pfizer-BioNTech vaccine is the vaccine which has secured approval from the US FDA and other healthcare regulators based on the submitted data supporting its efficacy and safety. Moderna, I understand, plans to do the same. And while a small number of countries have provided emergency approval for the Sinovac CoronaVac vaccine to also be used in these age groups, we presently do not have sufficient evidence submitted to the HSA to allow us to include those other vaccines in our present plans to vaccinate children less than 12 years of age. Vaccinating the children in this age group will extend our fully vaccinated coverage of our population well above our present 86%. And this will increase our resilience against COVID-19 as we make plans to cautiously open up our community to more social activities. In order to accommodate vaccinating our children, we will have to make some plans to prioritize more of our Pfizer-BioNTech vaccine stock for them. And for the rest of our population who continue to get vaccinated or to receive their booster vaccination doses, I wish to reassure that we have more than enough mRNA vaccine supplies for you, and you can go to our vaccination centers to get an mRNA vaccine, in particular the Moderna vaccine booster dose, even if you've started with 2 Pfizer vaccination doses. And if I share my own personal experience, my primary vaccination regime was 2 doses of the Pfizer-BioNTech vaccine, but when I went for my booster injection, it was partly for convenience going to a vaccination center that had Moderna booster vaccines provided, and I had a Moderna vaccine dose for my own booster jab. And this is perfectly safe and provides adequate continued protection against COVID-19. So I continue to encourage all of us to get vaccinated, and if you are eligible for your booster vaccinations, to get your booster vaccinations within the range of vaccines available that the expert committee has recommended. These are reasonable to receive. Either vaccine is fine, and it's all right to mix those doses. Thank you very much.
Sorry, I just want to add that I too took Pfizer, Moderna. So it's a MOH thing.
Thank you. Let me now invite Minister Iswaran to give an update on the travel arrangement and border controls, including the recently just announced Singapore-KL vaccinated travel lane. Iswaran, please.
Yep. Thanks, Kim Yong. Members of the media, good afternoon. Thank you for joining us. As you know, we started the VTL scheme 2 months ago. By 15th of November, when we commenced the joint VTL with the Republic of Korea, we would have established vaccinated travel lanes with 13 countries, 2 in North America, 8 in Europe, and 3 in the Asia Pacific. We still have some way to go in restoring our connectivity with the world. These 13 countries are less than 1/3 of the countries and regions with which we had direct links pre-COVID. The total number of travelers who may enter Singapore through the VTLs is about 5% of pre-COVID daily arrivals at Changi Airport. We must therefore press on with our efforts to reclaim our status as an air hub. Let me now share our next steps to further reopen our borders. Earlier today, Prime Minister Lee Hsien Loong spoke with Malaysian Prime Minister Ismail Sabri Yaakob to take stock of the discussions on the launch of vaccinated travel lanes between Singapore and Malaysia. Both Prime Ministers noted the significant progress that our countries have made in vaccinating our populations and managing the COVID-19 pandemic. They agreed that it is timely to progressively resume bilateral cross-border travel. The Prime Ministers agreed that Malaysia and Singapore will launch a joint vaccinated travel lane between Changi Airport and Kuala Lumpur International Airport from the 29th of November 2021. Malaysia is our closest neighbor. Our two countries are deeply intertwined with long-standing economic and people-to-people ties. Undergirding these ties is the close connectivity between our countries. Pre-COVID, the Singapore-Kuala Lumpur International Air Route was the busiest in the world, with about 40 flights daily and an average of 7,000 arrivals per day at Changi Airport. Due to the COVID-19 pandemic, both Singapore and Malaysia had to close our borders with limited travel subject to quarantine requirements. Families have been separated for many months and businesses have been affected. The Ministry of Health has updated its public health assessment, and Malaysia will be in Category 2 from the 12th of November. This is timely and it sets the stage for us to establish a VTL scheme with Malaysia. From the 29th of November, we will commence the VTL with 6 designated services between Changi Airport and KLIA. It will allow fully vaccinated travelers to travel quarantine-free between Singapore and Malaysia. For entry into Singapore, they will be required to present a negative PCR or professionally administered ART test result taken 48 hours prior to departure, and they will be subjected to an on-arrival PCR test. We will open applications for the VTL with Malaysia on the 22nd of November. The Civil Aviation Authority of Singapore will provide more details nearer the date when applications are open. We are also in discussions with our other ASEAN neighbors to reconnect with them, and we will make further announcements when ready. Turning to Europe, we have so far launched VTLs to 8 countries. As a next step, we will extend VTLs to Finland and Sweden. We have or had direct flight connectivity with both countries, and this will restore two-way quarantine-free travel with them. Like the VTL with Malaysia, we will launch the VTLs with Finland and Sweden on the 29th of November and open applications on the 22nd of November. CAAS will provide more details nearer the date when applications are open. We are also in discussions with our partners in the Middle East and Asia Pacific. We will closely monitor the situation and progressively extend the VTL scheme to more countries, guided by the Ministry of Health's Public Health Assessment and Risk Categorization, as well as operational considerations like the digital verification of the vaccination status of travelers. The experience with the VTL scheme has given us the confidence that we can reopen our borders safely. As of the 7th of November, close to 18,000 travelers have entered Singapore via the vaccinated travel lanes. Of these, 17 have tested positive. This is about one imported case per 1,000 VTL travelers. In tandem with the phased expansion of the scheme, we will increase the daily quota for our vaccinated travel lanes. We have currently allocated a daily quota of 4,000 travelers to cater to arrivals from the 13 VTL countries. We will increase this to 6,000 when we launch the VTLs with Malaysia, Finland, and Sweden. This is about 8% of the total daily arrivals at Changi pre-COVID. With the launch of the VTLs, there has been an encouraging upward momentum in passenger traffic. We expect this momentum to continue to rise in the coming months as we extend the VTL to more countries and public confidence in air travel recovers. At this juncture, I would like to thank our frontline workers at the airport, officers from the CAAS, from the Immigration and Checkpoints Authority, and the larger Changi Airport community, including our airport customer service officers and baggage handlers, who are doing their best to ensure the smooth implementation of the VTLs, to sustain service levels amidst the changing circumstances, and to maintain stringent protocols to safeguard public health. The additional requirements like pre-departure and on-arrival tests, the digital verification of vaccination status, and safe management measures at the airport are needed to protect travelers, workers, and Singaporeans. As the frontline officers endeavor to ensure adherence to these measures, it may take more time than we are accustomed to at Changi. I hope that travelers can understand and also do their part by, for example, completing their e-health declaration card before arrival. Together, we can ensure the Changi experience remains safe, smooth, and pleasant. So to conclude, I have shared our plans to extend the VTL scheme to Malaysia, Finland, and Sweden, and our efforts to reconnect with more partners in our region, the Middle East, and the Asia Pacific. Let me reiterate and reassure that we will continue to reopen our borders in a careful and calibrated manner with the essential safeguards to protect public health.
Good evening. Let me wrap up with some quick comments. First, I want to thank everyone in Singapore for your cooperation with the stabilization measures. Our week-on-week infection growth ratio has come down below 1. And while COVID cases in hospitals and ICUs remain high, the overall situation has stabilized. And that's why we are now in a position to make some calibrated adjustments to our measures. Minister Gan just now shared what these changes are, and let me elaborate on them. First, from 10th of November, we are allowing up to 5 fully vaccinated persons from the same household to dine together at F&B establishments. This easing applies to people who are from the same household only. If you are not from the same household, the group size for dining remains capped at 2 persons. F&B establishments will implement this new ruling by checking the status of diners before they are seated. And we will enforce this strictly. So the enforcement officers will do their checks and they will take firm actions against errant individuals as well as F&B outlets that fail to do the necessary checks. For now, this concession will not apply to hawker centers and coffee shops because these venues do not have in place the control measures to check all diners. But NEA and SFA are engaging the hawker associations and coffee shop operators. And for those who are able to implement the necessary control measures, we will be prepared to extend to them the same concession. And NEA and SFA will provide more updates on this in due course. Second, MOE will resume more activities in our schools and institutions of higher learning, and these activities include in-person classes, group work, and CCAs. Such activities are important in ensuring the rich learning experiences for our students and in their holistic development. So we believe this is crucial to resume. For schools, the term is ending soon, but it's about preparing for the new school term. IHLs are continuing, so many of these moves will be beneficial to students in IHLs quite soon, and MOE will be sharing more details very soon. Thirdly, we will pilot the resumption of more activities for fully vaccinated persons, subject to the additional requirement of them undergoing antigen rapid test. So today we talked about VDS, vaccination differentiated measures, settings or events where only vaccinated persons are allowed, and if you are not vaccinated, you have to do a pre-event test. It's vaccination or test. But we are moving toward a new protocol of VDS plus ART, vaccination and test, for additional precautions. And with this additional safeguard, we can ease further the safe management measures. We will start these pilots with team sports. So groups of up to 10 persons who are fully vaccinated and who are tested beforehand will be allowed to engage in team sports, whether it's football, basketball, at selected active SG sports centers and community clubs. We will also undertake pilots for selected sports events and MICE events, where, again, subject to the requirement of all participants being fully vaccinated and undergoing ART test, we will allow further easing of the safe management measures. If these pilots are successful, we will consider extending this new protocol of VDS plus ART to other settings so we can progressively resume more activities safely. Now, we have been careful in putting together this package of adjustments which we hope will be meaningful for families to dine together, as well as for sports, school life, and other activities to resume. All this while keeping risk under control. To continue with the analogy that Minister Ong had said just now, we are easing off slightly on the bicycle brakes, but we must not let our guard down and lose control as we go downslope. In the end, it's not just about adjusting the rules. It's also about how all of us as individuals and as a community behave and respond. And that's why it is so important that we continue to stay disciplined, take seriously all the safe management measures, and comply fully with them. If we take this approach, then we can avoid a sharp resurgence of cases, we can protect our healthcare system, and we can support all our healthcare workers through the coming weeks and months. After this move, we will continue to monitor the situation closely, and we will track the indicators that we have highlighted, which are important, whether it's the week-on-week infection growth ratio, the profile of serious cases, as well as the situation in ICU. But with vaccination and boosters, with the SMMs in place, and with the enhancement of the collective immunity in our population, I am confident we will be able to make further progress in our reopening over time while keeping our casualties low. Thank you.
Thank you. I'll invite questions from the media.
Thank you, Ministers and DMS. At this juncture, I'd like to highlight to members of the media that the embargoed press release has been sent to you. Please note that the materials are strictly embargoed until after the end of the press conference. I will announce the exact timing later. To the members of the media, please remember to use the raise hand function on Zoom if you would like to ask a question. A gentle reminder to speak slowly and into your mic when asking your question and to keep to one question. For the first question, could we have Timothy from Straits Times, please?
Thank you, Ministers, SMS and DMS. Now, last week, Dr. Janelle told Parliament that the government is trying to stem the spread of COVID using vaccines, boosters, as well as, I quote, even more boosting for mild infections. Does this mean that Singapore is going for a strategy which involves herd immunity? And if so, how will the number of infected contribute to the easing of SMMs? Is there a target or threshold number of infected people that the government is looking at before we ease further? Thank you.
I know you were referring to Dr. Janil, but let me try to answer on behalf of MOH. I do not think we want to say that we use infections as a way for us to reach herd immunity. We still want to largely use vaccination and boosters. But we know that with Delta variant, vaccination, any vaccine now, is not sufficient to significantly lower infection rate. It does give a layer of protection against infection, but it's not 100%. So as of now, for us, it's about 40% protection against infection, but 90+% protection against severe illnesses. So given that there will be infections, but we also know that once you are vaccinated, and even young people unvaccinated, if they catch the virus, they do recover, and when they recover, they do gain natural immunity. What we do need to do is to protect the unvaccinated people who are older, particularly the seniors. So that is the process, the natural process that is happening, and we know that as we accumulate antibodies in our society, either through safe recovery of infections or through vaccination and boosters, we become more and more resilient. We look at other countries ranging from 5% to 12% of their population getting infected, they start to achieve some form of equilibrium. But it ranges between countries. I don't think there's an exact science to it. It depends on a host of factors. But what we do know, keep on working on the breaks we talk about, keep on striking a balance between safe management measures, vaccines, as well as making sure our hospitals are not overwhelmed. We balance the three, neither Freedom Day or zero COVID, and just keep on controlling the speed of our progression, and I think we will get there.
Maybe I can add that our strategy is not one where we have set a target, and beyond that, we open up and free for all. I think we have decided to take a step-by-step, a more cautious approach, a progressive approach. So as we have introduced some easing today, and we will watch and monitor how the situation evolves. If the situation remains stable and not the hospital healthcare system is not under threat of being overwhelmed, then we have a room to open up further as time goes on. So we want to do this in a progressive way, in a step-by-step approach, meaning taking the analogy of a bicycle, we don't really want to dismantle the brakes. We want to be able to continue to monitor as we ease off the brakes and allow the bicycle to continue the journey. So as we journey towards COVID-19 resilient, we want to be able to adjust these measures in a step-by-step approach.
Okay, thank you, Ministers. For the next question, could we hear from Ke Yang from Taobao?
Hi, good afternoon, ministers and DMS. The question we have is, will the MOH be contacting all children who have recovered from COVID-19 to be screened for MISC?
Can you speak slowly and into the mic, please?
Hello. Will MOH be contacting all children who have recovered from COVID-19 to be screened for MISC?
Thank you very much for that question. I understand the question to be whether MOH will be contacting all children who have recovered from COVID-19 infection to see whether they have MISC. All children who have recovered, who had previously spent some time in our hospitals, are routinely followed up by the hospitals to ensure they make a complete and full recovery. And in that setting, if these children are found to have additional symptoms even after they're supposed to have recovered, which raises the suspicion of MISC being present, then the hospitals would investigate further. And for the children, they are quite prepared to bring these kids into the hospital for further tests, and depending on the severity of these symptoms, if necessary, admit them for further care. And this is the context in which the four, and now as SMS Janil has mentioned just now, a fifth case, this was the context in which these 5 cases were picked up.
Thank you, DMS. For the next question, could we hear from CNA Digital's Ang Hui Min?
Yeah, thanks for taking my question. I think there'll be a lot of interest and demand for the Malaysia VTL. So my question is, what proportion or what number of the additional 2,000 daily arrivals will be, I guess, proportioned or assigned to people arriving from Malaysia when the VTLs launch? And, is there a sense of whether this will be enough to meet, I guess, what is pent-up demand for travel between Malaysia and Singapore? Thank you.
I suppose I'll take that. If I understand your question correctly, is whether the additional capacity that we are going to be now assigning for the daily VTL quota for Malaysia-Singapore travel, whether that will be adequate for the anticipated surge in demand. This is a challenge we are faced with all markets. It's not just Malaysia, in the sense that there is obviously a desire for travel cross borders, whether it is families reconnecting, workers wanting to return home, the students wanting to either return home or go to their places of learning, and also businesses and so on. In short, the answer is this: there will be 6 flights a day. Those 6 flights should be able to manage the initial demand, and our approach has always been to monitor the demand, work with the airlines, and then respond in a more dynamic way. So I think we are at a very early stage with respect to the travel with Malaysia. There are several operational issues that will have to be run in. For example, the on-arrival testing procedures, how they will be conducted, the pre-departure protocol requirements, and how travelers are able to comply. So I would request that we allow the scheme a bit of time to run in. I am quite sure that once we have gained the experience, we can then look at further expansion, whether it's with respect to Malaysia or also on other fronts.
Let me also clarify that what Minister Iswaran has announced is the air link between Singapore and KL. Of course, between Singapore and Malaysia, you still have a land connection, and Singapore and Malaysia are now in a discussion on how we can also launch the VTL for land connection between Singapore and Johor and beyond. So this is something that we are discussing, and we will share more details when we are ready.
Thank you, Ministers. For the next question, could we hear from Channel 8's Shu Xuan?
Hello, good afternoon, Minister and DMS. Can we request, for the benefit of our audience, can we request Chinese soundbite on the progress of children vaccination plan and also the relaxation of dining in measure? And my question is really on the booster shot. So understand that public can actually choose from either brand of the mRNA vaccine. However, there are also people who are really, concerned or rather unsure about which vaccine to take as a booster shot. So wondering, is there any final recommendation from our expert committee on this? Thank you.
On children, you want that in Chinese, huh? Let me see if I can. Okay, why don't we come back to this question? Give me some time.
Yeah.
Yeah, as far as the booster vaccinations are concerned, which I think was also the question that was asked, the expert committee for COVID-19 vaccines has recommended that either of the mRNA vaccines are safe and effective for the purposes of doing boosting. So if you started out with, say, the Pfizer vaccine for your primary regime, it's okay then to cross over and have a Moderna vaccine. If you started out with a Moderna vaccine, you can also cross over to get the Pfizer vaccine. And it's also equally effective if you stay the course. In other words, if you had Pfizer and Pfizer for your first 2 doses, then continue on with a Pfizer vaccination is also fine. As similar to Moderna. And these booster vaccinations, particularly when we're looking at the experience in other countries, has been found to be very effective. In Israel, for example, they've based their booster vaccinations primarily on the Pfizer vaccine, although they have now also been using other vaccines, including the Moderna vaccine, but predominantly using the Pfizer vaccine. They've shown excellent results in bringing their epidemic in their own country under control. Bringing the number of severe cases down and allowing the healthcare system then not to get out of control with the resources that they have. So the booster doses, based on our EC19V, these doses are all fine, and the expert committee recommends that any of these vaccines can be used for this purpose.
好，我用华语回答。最近家长都比较关心孩子的健康跟安全，因为病例多了，小孩子的病例也多了，所以大致上小孩子得到冠病都会非常顺畅的会恢复，但是一个非常小部分就唤起了比较严重的疾病，这就叫 MIS-C。跟那个 Kawasaki disease 有点相似。新加坡每年大概有150到200名孩子得到 Kawasaki disease。现在因为冠病的关系，有4位孩子也得到了这个 MIS-C， 就类同 Kawasaki disease 的这个疾病。今天我们接到报告，有多1名小孩子得到了这个疾病，所以5名小孩子在8000个病例之中得到了这个 MIS-C， 就大概0.05%的孩子得到这个疾病，所以家长当然比较关心。卫生部一向来都一直跟大众报告，说我们跟辉立一直有在探讨怎么样的能够为孩子接种疫苗，因为接种疫苗后可以防止孩子得到这些疾病。我们常常报告就是说，这个过程可能要等到明年，明年结束了这个过程，为孩子接种疫苗的这个步骤才可以，这个计划才可以开始实行。上个星期有一个重要的发展，就改变了我们的现有的计划，就是美国的 FDA 他们的有关当局已经批准了用 Pfizer-BioNTech 的这个疫苗为5至11岁的孩子接种疫苗。所以现在在 Twitter 你可能看到很多小孩子接种疫苗的相片。这个美国的这个决定呢，是经过临床实验跟过后才决定的。这个临床实验呢，是非常大型的，而且他们用的就是成人的这个疫苗的1/3给小孩子，而且研究的结果非常的确定。这个疫苗就是用成人的1/3的成分给小孩子，是安全也是有效的。 我们的这个专家团队，就是我们的 EC19V， 也参考了，也仔细研究了这个美国的研究报告，他们也同意这样的做法是安全也是有效的。所以接下来，我们的 EC19， 我们的这个专家团就会在这个11月的下半个月呢，会继续的检讨，然后呈上他们的建议跟报告，就是说我们新加坡会不会进行为小孩子5至11岁的小孩子接种疫苗？一旦接种过后，一旦他们决定过后，我们就可以开始。所以呢，我们现在尽量的积极做这项工作，尽快的为我们的孩子5至11岁的孩子，尽快的能够让他们接种疫苗，好让家长们、孩子们、家庭的成员们都可以安心。
Let me just say a bit about the dining rules in Mandarin. 因为目前的这个疫情情况比较稳定，我们可以逐步放宽一些措施。所以从11月10日起，同住的家庭成员将可以在餐厅最多5人一组堂食。条件是这些场所必须能够确保食客已经完成疫苗接种，而且多是同住的家庭成员。小贩中心和咖啡店暂时不包括在内，因为这些场所还不能有效确保食客都已经完成接种疫苗，或是同住的家庭成员。所以我们会跟这个小贩商联会和咖啡店业主继续探讨这个问题，看怎么样有效的推行这个新的措施。
Thank you, Ministers and DMS. For the next question, could we hear from Chen Lin from Reuters?
Good evening all. So I would like to clarify first, when would Singapore start vaccinating kids age 11, following the recommendation which is expected second half of this month? And also, secondly, has Singapore signed contract with Pfizer for their COVID-19 oral antiviral drug?
Sorry,
Yes,
just a
what's the
reminder to keep to one question at a time. Thank you.
A short answer. As I mentioned earlier, we have a set of activities now, starting with EC19, making a recommendation. We expect second half of the month. And so with that, and we're also doing our own study. So all this will pave the way for us to start this vaccination for children as soon as possible. And as DMS said, if we can use the adult dose, but 1/3 adult vials, but 1/3 of the dose, that means we also have the stock. So we'll just start as soon as possible. Right now, we can't pinpoint a date, but I think in 2-3 weeks' time, it will be a lot clearer, and then we will report to the public again.
Thank you, Minister. Can we have the next question from Bernamas Masita?
Hi, Ministers and DMS. Thank you for the VTL. I'm happy. Just one question. What will happen to PCA arrangement? With VTL in place, would the arrangement continue? Thank you.
Yeah, thank you for the question. I think basically the VTL is an arrangement on top of all the existing arrangements that we have. It is really designed to facilitate the bilateral quarantine-free travel, regardless of the purpose of travel. So it's in addition to, not in lieu of, the existing arrangements that we have.
Thank you, Minister. For the next question, could we hear from Janice from BT, the Business Times?
Yeah, hi, Minister. Thanks for taking my question. This comes from the perspective of the fact that I think some F&B outlets will be quite worried about the risk that 5-person dining could be rolled back. So my question is, the public holiday last week might have resulted in a lower than usual number of tests. So is there a mathematical risk that we might see the ratio rise again? And if that does happen, presumably the MTF will take a longer term view of the ratio and kind of wait for that last week blip to be evened out.
Yep. As Min Gan explained, and we have tried to explain many times, we don't operate on the basis that you reach a certain number and therefore we do certain things, because the situation is just so dynamic and we are balancing between safe management, vaccination, hospitals, and that is the balls we always juggle in the air. So that is also good in the sense that even if the ratio goes to 1 or slightly above 1, doesn't mean that we'll revert, because we don't work that way. One of the major factors that has led to this decision is also that ICU numbers have been stabilized, has been quite stable, and it's reported by SMS Janil. So I think it's on balance, given that vaccination and boosters has been progressing well, ICU situation is stable, and at the same time the ratio shows that R is coming down, that I think on balance this is a sensible thing to do. So long as you go out as a family, you are really one infection unit. And so I don't think that per se is going to increase the risk by a lot, but there will be some increase in circulation because more people may come out and visit the restaurant, so that may increase some exposure. But on balance, I think it's something we will be able to handle given the current conditions we are in.
Just to add that, as I mentioned in my remarks just now, and as Minister Ong also said, we had considered very carefully this package of adjustments in our measures. And we think with this package of moves, the additional risk is acceptable. But what really matters is how people respond to the measures. Because I think there is general compliance with the safe management measures, people go out but strictly maintain as one household and follow the rules, then we should be able to keep the risk under control. Yes, there may be more opportunities for the virus to transmit within the community, and we must be mentally prepared that the week-on-week ratio may go up from where it is today, but we can wear through that and we can ride through that without our hospital situation being overwhelmed. But if people let the guard down and see this very controlled move as an excuse to just let their guard down, go out and relax, celebrate, I think then we will go beyond what our expectations, and we will see the ratio rising much higher than what we have anticipated. So the key, as I mentioned, is not just about the rules, it's also about how all of us respond to the rules and continue to maintain that sense of discipline and responsibility. And if we have that attitude and mindset, we can take this continued approach, step by step easing. Each time we make one move, we will monitor the situation. Overall situation remains stable. We can make that next move. And then over this period of time, with vaccines, with boosters, with additional enhancement of our collective immunity, we will be able to continue that path of reopening.
Thank you, Ministers. We will now take the next few last questions. So the next question, could we hear from Sherlyn from CNE?
Hi, Ministers and DMS. I have a question about the biggest clusters in Singapore currently. I understand many of the biggest currently is at IMH, and there are many nursing homes that are also being monitored as a cluster. So I'm wondering, does the Ministry have any more information about these clusters? Because visiting has already stopped for these places, but why is infection still spreading? Are there any gaps that need to be filled?
Thank you very much for the question. And you've asked about some of the clusters that we had previously announced in the IMH campus as well as in nursing homes. We have investigated some of these, in fact, all these clusters, looking at possible chains of transmission. And these are difficult settings because many of the residents are not able to adhere completely with all the safe distancing, safe management measures. Not all of them find it comfortable, or it's very difficult for them to wear a mask all the time. and therefore the potential risk of spread occurs in such communal settings when these residents interact very closely with each other. So at any time, if there were infections that were introduced, sometimes this might be as a result of new residents coming into these homes or into the hospital, and they had previously been exposed in the community, passing the incubation period and then manifesting with infection. Subsequent spread into these settings can take place. We have been aggressive about reaching out, trying to promote, educate, and to get all residents and staff to continue to comply with hand hygiene, infection control measures, the safe management measures, and we will continue to do so in order to promote a safe environment for all residents and staff to work both in the hospitals, in IMH, as well as in the nursing homes. One particular strategy that we've been working on is to ensure that the nursing homes and our hospitals have a high degree of vaccine coverage, both for staff as well as for the residents in the nursing homes. And I'm pleased to inform that we've made progress in ensuring that a high degree of vaccination coverage exists among our nursing homes. In fact, in many of the nursing homes, it exceeds 90%. And where these residents have themselves had their vaccines, the original doses given quite some time ago, they're now eligible for boosters. We are engaged in arranging for these residents also to get their booster vaccinations. This continues also in the Buangkok campus, where a number of the nursing homes may be located. And this would help to increase the resistance of residents in these nursing homes to further infection and help to disrupt further spread of infection occurring within these settings as well. But in short, challenging settings where residents are in, and we will continue to work at helping to reduce the possibility of spread in these nursing homes. That said, when we look at the daily numbers, many of the numbers that we are now reporting actually occur in clusters where that previous exposure had been at the time when the first index case had their infection. They've now been put in some form of isolation, limited movement, and where we're seeing more cases starting to come out is really in this group of people who are now quarantined as a result of their previous exposures. So we think the measures that are being taken by the nursing homes themselves, as well as the clusters, are starting to see some effect in disrupting the transmission, and we are optimistic that many of the clusters that we have previously reported can be successfully closed as the infection comes under control.
I should add that MOH, we diligently report the clusters whenever we find them in hospitals or in nursing homes. But actually, amongst the seniors, those who are infected in nursing homes is a small proportion of all seniors being infected. In fact, the great majority of infections of seniors happen in the community. And amongst seniors who are in ICU, need ICU care or passed away, nursing homes account for 6-point-something%, less than 7%. Great majority of infections of seniors as well as young people happen in community.
Thank you, Minister and DMS. For the next question, could we hear from Yahoo's Nicholas?
Good afternoon. Given that our goal is to live with COVID, endemic COVID, to what extent are we still contact tracing, especially given that cases are now running into the thousands every day? And when might the use of trace together cease?
Sorry, we'll keep to one question. Yeah. Thank you.
We are currently still carrying out contact tracing and epidemiological investigations, but where we focus on now is not a blunderbuss approach where we do very aggressive contact tracing and isolating of many people across different sectors. We're focused on where we have concerns about vulnerable people being exposed, where potentially transmission may occur towards vulnerable people. So we are particularly meticulous when it comes to contact tracing that occurs in hospitals, in healthcare settings, in nursing homes, in institutional settings, in the schools, in preschool settings, where we have an interest in making sure that those who are not able to vaccinate themselves that we are able then to protect them further by making sure that we disrupt these chains of transmission. Some contact tracing does occur in relation to other clusters, But we have worked on the system where we share this responsibility, not just by the Ministry of Health doing this, but also by the various sector leads that are responsible for the individual sectors. So they take some level of leadership and ownership to identifying how spread may have occurred within these other settings, whether it's in hawker centers, whether it's in other settings, and they will carry out the relevant and appropriate actions to disrupt spread, including shutting and closing premises for cleaning, educating, and engaging in more testing that takes place within these settings itself. So we are now more targeted in our contact tracing. It's not that we've given up on doing this, but we do it in a much more focused manner in order to make sure that the vulnerable people are continuing to be protected.
Thank you, DMS. For the next question, could we hear from Mothership's Alfie?
Hi, ministers. Can you hear me? Yeah, I just wanted to ask whether social gatherings and home visits are limited to 2 and how long this will continue. Thank you.
Yes, they are limited to 2 persons. The move for 5 persons is limited to F&B restaurants, outlets that are able to do the necessary checks, as I said. So for all other social gatherings, including house visits, the rule of 2 will still apply. When can we make this move to adjust further? Well, as I said, we are making one move now. We will monitor the situation over the coming weeks, and based on all the indicators that we monitor, if overall situation remains stable, we will consider what the next move might be.
Okay, thank you, Minister. For the next question, could we hear from Bloomberg's Derwee?
Hi, good evening, ministers. Can I ask what exactly is the timeline looking like for a resumption of work, return to office? Thank you.
Well, it's similar question, whether it's the group size of 2 persons in a more general context or the work from home rule, whether that can be relaxed further. These are things that we continue to review, to monitor. We have considered very carefully the whole package of measures which we have just announced today. Let's monitor what the situation will be in the coming weeks after this round of easing. And if the situation remains stable, we will consider the next round, the next step, which will take into consideration all the different parameters.
Thank you, Minister. For the next question, could we hear from Howie from Shinmin?
Okay, hi, ministers. Okay, I understand from some parents and also F&B operators, to verify that families from the same household can be difficult if they have children that are under 15 because they don't have IC, so they don't have anything that has the address to show that they are from the same household. So, so how is this going to be implemented?
We will take a practical approach. If there are adults with children, it's very likely that they are going to be from the same household. But it's also quite clear which are the groups that will not be from the same household. And if these groups do gather together in a restaurant, perhaps the individuals pretend that they are from the same household, manage to get around the entry checks at the restaurant, or perhaps because the restaurant itself doesn't put in place a proper system of control. That's when we will take firm enforcement actions.
Thank you. I think this question also illustrates that it is very challenging as we open up, as we try to restore more activities, that there will be a lot of these minor issues that we need to deal with. But I think the biggest message is that while we can put in all the rules to check individuals going to restaurants, doing house visits or going back to work, at the end of the day, actually it is our individual responsibility to make sure that we don't try to find gaps to bypass the rules. Because eventually it is to protect ourselves and to protect those who are around us. So let us do what is responsible. If we say that we only allow the people from the same household to dine together, please try to observe these guidelines, these rules. And if you know that you are not from the same household, please don't go out and dine together, not more than 2. Yeah, so I think it is important for us to understand the spirit behind it, and if we are able to observe these rules and guidelines, then it will allow us to continue on this journey towards COVID-19 resilient in a steady way. Otherwise, we will have to keep stop and start all the time because we are not able to enforce the rules. So I hope Singaporeans will understand and to cooperate with us and support our efforts in this and try to observe the spirit of the rules. And even if there are no one checking on you, please make sure that you are from the same household.
Maybe remember where we were just a month ago or 2 months ago, cases doubling every week, every 10 days, and we don't know when it will end, when it will peak. As it turned out, we peaked, we stabilized and come down a bit. And given that bicycles slow down a bit, we designed this package, controlled, and we can gain back some liberty. And then just as Min Gan say, exercise self-responsibility. Cases probably will go up some after we open up. But then we are also day by day becoming more resilient, and it will turn down again. And that will give us another opportunity to open up again. So step by step, piece by piece. I think we just have to keep on going at it and continue this process. We are making progress. Just think about what happened 2 months ago, 1 month ago, and now there is a lot of progress. So let's us continue to work together at it.
Thank you, Ministers. We will now be taking the last 2 questions. For the next question, could we hear from today's Nabila?
Hi, panelists. Thanks for taking my question. I just want to find out if the government has any plans to buy the Pfizer COVID-19 pill for use here. And at this stage, is it possible to project when the pills can be approved in Singapore, including the one by MSD?
Thank you very much for your question. We have been looking at purchasing and procuring various types of medications to help to improve outcome in our patients with COVID-19 infection. So this is including vaccines, of course, monoclonal antibodies. We've talked about remdesivir in the past. We've talked about now the oral tablets, both from Merck as well as from Pfizer. We're looking at this very seriously. But most of the reports have come out so far have been in the media. So we are actually looking for the actual, for example, articles, publications for studies that have been done using these new medications, as well as data that the companies will submit to health regulators so that we can more objectively assess the benefit of these medications. Certainly, based on the media reports, they sound very promising. You know, if you're talking about a drug that can have 85 to 90% effectiveness in reducing death or severe infections, that's certainly an important weapon in any country's armamentarium when it comes to trying to fight COVID-19. But we wait for more details so that we can make a proper and objective assessment and make a decision then whether to procure these medications for Singapore. And we will do that for the different classes of drugs and the new drugs that are always being announced coming onto the market.
Thank you, DMS. The final question comes from One Paul's Kang Wei.
Hi, good evening, Mr. and DMS. So it has been almost a year since we started the vaccination program. So we're wondering if the ministry is keeping track of whether antibody level for vaccinated individuals are dropping, and whether this will mean that people who would not receive their booster shot will not enjoy the benefit of the vaccinated differentiation standard as well. Thank you.
I think first you have to be clear that antibody levels are not the only or most important marker of immunity. And the way vaccination works in your body, your antibody level can drop and you can still mount a very serious immune response. So testing everybody for their antibody levels is not a good way to then establish whether an individual or a population has effective immunity or resistance to a disease. What we do know then is that time matters, how long it has been since you've had your vaccination, the interval between your shots, and your boosters, as well as then time in terms of your age. The way in which you respond to vaccination will change as you get older. So the effectiveness of the booster shots has been well demonstrated in clinical trials. So we just need to wait for the appropriate time after your primary series, have the booster shots, and then we have a reassurance then that you are much better protected. Will that need to be dealt with in the future as immunity wanes? Possibly. Not enough time has passed because this has been with us only a short period of time. But we do have some models, such as from influenza and other infections, where you may need further vaccinations later on. But it's too early, it's too premature to go down that route at this point in time. The key thing I want to get across is that the antibody levels are not the way to answer that question. The research that's been done tells us that having the booster shots is effective, and the time period is much more important.